Welcome back to Take on Healthcare. I'm Mary Sheehan, pharmacist, here with my co-host, Dr. Ted Suzelis, naturopathic doctor. And today we're diving into a topic that both of us have touched on before, chiropractic care, but with a fresh perspective from someone who has spent over 2 decades helping patients heal naturally. Now, I have to admit, my own journey with chiropractic may have started out like a lot of people's, thinking it was just about back pain. But now I realize it is so much more than that. Chiropractic has evolved, techniques have improved, people are now holding their adjustments longer and seeing lasting benefits. But despite all the progress, the misconceptions are still out there.
And that's exactly why we wanted to have this conversation. Today, we are joined by Dr. Suzanne Shaw, a chiropractor and friend of mine who has treated everyone from newborns to pro athletes. She's an expert in the chiropractic technique, the Activator Method, and has a deep understanding of how chiropractic care goes beyond just pain relief. It's about the nervous system, whole body wellness, and long-term help.
One of the biggest questions we'll be asking today is why some people don't hold their adjustments. Is it just about alignment, or does it go deeper? Nutritional deficiencies, chemical stress, emotional stress. Think about it. You slam on the brakes in traffic, your muscles tighten, and suddenly your whole body is out of whack. What role does chiropractic play in handling these everyday stressors?
And where does chiropractic fit in the bigger picture of healthcare today? What role will it have in the future? We're going to get into all of it, and I think you'll be surprised by how much chiropractic care can impact your overall well-being.
So whether you're a chiropractic regular or a skeptic, stick around. We've got a great conversation ahead with Dr. Suzanne Shaw, and you won't want to miss it.
You're listening to Take on Healthcare with Ted Suzelis and Mary Sheehan. When you think about chiropractic, do you think about having your back or neck adjusted? Do you dread the idea of multiple visits that never fix the problem? Well, think again. On today's episode of Take on Healthcare, Dr. Ted and Mary sit down with a chiropractor who uses a unique combination of advanced technology and holistic healing modalities to bring real, lasting change to patients of all ages.
So we're here today with Dr. Suzanne Shaw from Backs and Us, and she's going to explain how an adjustment works and what she's going to do while she's adjusting me.
Today, he just said, I'm going to adjust him using the activator. And I use the activator protocol and the activator method. It's a spring-loaded tool that works on speed rather than force. And I do specific checks, neurological checks, and I do a series of leg length analysis to see what is exactly out of alignment. It's important that I lower him down on the table so that we can get the accurate weight-bearing view of the spine. Because if he crawls on the table, he might be a little bit crooked antalgically, like the pain might cause him to be in an abnormal position. So, and then after the adjustment, I'll feel his spine, make sure everything's good, and then I'll raise him up off the table in the corrected position. Dr. Ted, I'm going to get you on the table. Step on the platform, please, and put your face in the face caper. Hold on to the sides, and the table's going to gently lower you down. And the platform's going to drop out from under your feet. So I'm going to do a series of leg length checks. The first thing I notice is that your right leg is about 1.5 inches shorter than the left. So my goal is to straighten you out or get your leg lengths even. So the first thing I notice is your right knee is off. So I'm going to adjust your right tibia. And it's off medially also. So I'm going to do medial tibia and your ankle. And then I'm going to check your pelvis. Your right ilium is higher than the left, so I'm just going to push it downward. Okay. Put your right hand on your low back, please. Good. Right hand down. That was a test for L5. The right leg got shorter, so I need to adjust L5 on the right and a little on the left. Put your left hand on your low back, left hand down. It's a test for L4. Both hands on your low back. and both hands down. L2 was out. Right hand up by your head, resting on the table. Good. And right hand down. Left hand up by your head. And left arm down. And then both arms up by your head. And both arms down. That was T8, was positives. Turn your head to the right. And raise your right shoulder off the table. Drop it down. Shrug your shoulders, relax, and face down. That was T6 and T4. Turn your head to the right. Again. Thank you. Raise your right shoulder off the table, drop it down. Shrug your shoulders, relax, and face down. Then turn your head to the left. Raise your left shoulder off the table. Drop it down and face down. Then look up at the wall or the corner and face down. Tuck your chin to your chest and relax. Push your face into the paper and relax. His C5 is out of alignment. Push your face into the paper and relax. Tuck your chin to your chest again and relax. C1 and C2 were out. Okay, now squeeze your right elbow in towards your body. Good, relax. Squeeze your left elbow in and relax. Okay, I'm gonna adjust your right shoulder blade. Shoulder, elbow, and wrist because it's a chain reaction. Then I'm gonna work on your feet. The feet are so important because they hold your whole body up, and if the bones in your feet are not in alignment or if they're stuck, it can affect the way you walk and your gait, which causes a chain reaction of things that could go out of alignment, like your knee, your hip, your pelvis. I'm going to bend your legs up, double check. Okay, that looks good. Your leg lengths are even. Now I'm going to feel your back. Drop your arms down to your sides. Just going to use my thumbs and walk up your spine to make sure everything's still in alignment. And if anything's still stuck out, then I'll just click it again. And I do a little suboccipital stretch, and I push the occiput away from C1 to create a little space, and it helps so that you don't have so much compression. Okay. And then every patient, I always rub out the upper back because a lot of people carry tension in their upper back, neck, and shoulders. So I always rub this out so that there's less resistance. Okay, and then I do a little stretch. Here. And take a deep breath in and let it out. That feels good. Now I'll You are even. Double check. Okay.
So thank you so much, Dr. Shaw. I really needed that adjustment, and it felt really good so that my back and neck and everything feels so much better. Could you just explain to our viewers exactly what you saw during my adjustment?
Yeah, I noticed that your right leg was shorter than the left by about 1.5 inches.
Yeah.
As I started to adjust you, the main area that was out the worst would have been your low back, like your L5, S1 area, and L4, L5.
Okay.
Did I say L5, S1? Yes.
Yes.
Yeah, those two lower segments were out the worst.
Okay.
But other than that, you evened out normally, like a normal healthy person.
Yeah.
And as I would expect, and you were good.
Awesome.
Good now.
So that's what we would expect when we come in to Vaccine Us to get an adjustment with Dr. Shaw and her staff doing the Activator Method.
So welcome, Dr. Shaw, to Take on Healthcare. We have not had a chiropractor on.
No.
We like chiropractic.
Mm-hmm.
It's very interesting that we haven't gone down this road yet. So we're really happy to have you here to really explain it to us, because a lot has changed. Like I was telling you during our pre-interview, I found chiropractic care, like stumbled on it when I was pregnant with my first child. And I realized that, my goodness, how do people go through life without a chiropractor? Like that's an extreme example, right? Because your spine is changing as you're pregnant. But that woman changed my life. She gave me all kinds of health advice. And after the birth, adjusted my spine. Like we all need that, right?
Mm-hmm.
And then talking to you, I've realized that a lot has changed in the realm of chiropractic care. So I'm excited to hear about that.
Oh,
Yeah.
you want me to talk about
Well, we're
chiropractic in pregnancy?
or just,
Yes.
well, do you see pregnant patients?
I see a lot of pregnant females.
You do.
Yes, from the beginning to the end, and of pregnancy, and then even after pregnancy. Because oftentimes the center of gravity, this is what happens when a woman is having a baby, it changes, it shifts forward. So
Yeah.
they oftentimes have low back pain, sciatica, and if the pelvis is in alignment before the baby is ready to come out, then the pelvis is able to open up to allow room for the baby to come out. And then when it goes back into alignment, sometimes it doesn't go back correctly
Mhm.
after the baby's born. So I'll see the patient after the birth too. And then I have 2 patients, because then the babies get checked as well.
Oh, you work on infants.
Mm-hmm. Yes.
Interesting.
Yes.
So what is it like to adjust a baby? Like I didn't even think about that. Although I
Okay.
probably, have your kids ever
Yes.
been adjusted?
Yeah.
Yes.
Well, they lay on Dr. Shaw's,
Yeah.
especially Evan, just lays there and just gets it all done. And,
Really?
oh, yeah.
He loves it.
Oh, yeah, he loves it.
So how young were they when you started them with that kind of care?
No. Oh, I'm
Like
kinda-
infants?
No.
Okay.
No, I mean, my brother, as a DO, has done some when they were younger.
Oh, because he can adjust.
Right.
Okay.
Right. Probably within the last 5 years or so that they've seen you.
Mm-hmm. I would say about 5 or 6 years, maybe.
Yeah.
Yeah.
At Take On Healthcare, we don't create content just to follow the latest trends. We tackle the real health topics that matter. But here's the deal. If you don't like, subscribe, and comment, the algorithm won't share this with others who need it. So if you really appreciate these discussions on wellness and natural medicine, take a second to support the show. It's quick, it's free, and it helps more people to get access to this information. Thanks for being part of the movement.
So I treat babies.
How would you know a
Okay.
baby needs an adjustment?
Because they were born. Going through the birth canal is the hardest thing that they ever go through. And what happens is they'll grab the head and they twist and torque, and they can allow up to like 120 pounds of pressure to pull the baby out. So the vertebrae can get stuck. So it could be a cranky baby, or maybe they don't have a bowel movement, or maybe they're throwing up constantly.
Oh my.
There are so many
We attribute
colicky
that to all
babies.
kinds of things, don't we? Like people would stop breastfeeding because of that, like the baby's throwing
Right.
up, and that could just be something that happened to their little.
Yes. Yes,
my goodness.
absolutely. Oftentimes it's either C1 or T8 that's out of alignment on the babies. That
My
I
C1
find.
is where?
The very
it-
first vertebrae
Okay.
underneath the skull.
Which makes sense if they're going to be too aggressive.
Yeah. Now, if they I hate to say this, but like if they put over 120 pounds of pressure to pull the baby out, it can sever the spinal cord.
What?
It
I
is
had no
very
idea.
dangerous. It's
Yeah.
a very dangerous thing to have a baby, because the mom's at risk and then the baby can be at risk too.
Right.
I had no idea.
But yeah, my son was about 3 hours old when I gave him his first adjustment.
Wow.
Yeah. So, and I've seen so many babies, it's unreal. Like one of the babies that I saw, he was about 6 days old and he wouldn't latch on. So I treated the mom during the pregnancy. She brought the baby in and his jaw was out of alignment. So something happened during the birthing process. So he was not able to latch on. So she was going to the lactation consultant. The lactation consultant couldn't figure it out. So right after the baby's adjustment, and their bones are like cartilage. So it's very soft. So it's like the tip of your nose or your ear because they're not ossified yet. So you just put a little bit of tender pressure on it and the bone will move. It's so easy. And I just use my fingers to feel it out and then to put it back in.
Wow.
So this baby's jaw was out. And as soon as I put slight bit of pressure on it, the baby started to cry.
Oh.
And I said, it's good because he's hungry now. I said, go to the back and see if he'll latch on. And she was back there for about 30 minutes. And she said, he has never done that since he was born.
That is so incredible. I just think of the domino effect of not seeing it from that perspective.
Yeah. And then it's important to train the moms to hold the baby like a football and go from the right breast to the left breast back and forth because it helps with the neurological development of the brain. So even if they're feeding the baby with a bottle, oftentimes if they're bottle feeding, they might be getting breast milk, but it's comfortable for the parent to go on one side.
Right.
They never switch over. So that can cause some neurological issues in the child.
That is so
long term.
interesting.
Yeah. So just little tips like that is, I don't know, it's important.
And I would assume too that, that could also lead into higher incidence of ear infections.
Sure.
That's what I was
Absolutely.
thinking too.
And an ear infection, babies will come in with ear infections. And usually it's just C1 that's out.
Mm-hmm.
And they typically medically, they'll put them on antibiotics.
Right.
And then another round of antibiotics. And then another round. And then another round. And then tubes.
I've seen that in my, as a pharmacist, I see that.
Mm-hmm.
And it's just, I didn't realize when my kids had ear infections, I took them to a craniosacral person.
Okay.
Yeah, to pop it out. I used to say, let's just get that popped out. I didn't, because I didn't have or didn't know I had a chiropractor trained in that way in my area.
Yeah, and I do craniosacral too. I've been trained in it. So I do work on the skull of the baby too to make sure their head is shaped right, because sometimes when they come out they have a funny shaped head and the plates aren't matching up. So I just put light pressure as the baby's breathing to get those plates in place.
Is that why you've seen, and I've seen recently some little kids that have that helmet on?
Helmet, yes.
Yes. Is that what it's trying to do?
That's what it's trying to do.
Oh.
But I don't do helmets. But I do.
You probably don't.
I just use.
But you don't have to.
Yes, it's a different method. And then I had a patient that, oh my gosh, he had some genetic disorders, and he was about 3 years old, never sat up in his life.
Oh.
So he just kind of laid there, and he can move his arms and his legs and stuff. And I remember treating him one time, and then the mom didn't come back, and I saw her at church, and she said, "You've got to see this." And she said his name. She showed me a picture. She said that night he sat up for the first time, and she showed me a video of it.
Wow.
And he had been through physical therapy. He'd been through everything. But his lumbar spine was out, and his pelvis was out, and his sacrum was out.
So interesting. So
he
even
was stuck.
Yeah. So even with the physical therapy, I have a real clear vision of that, how that would never work if that's the problem.
Yeah. So you can work on the muscles all you want, but if the vertebrae and the spine isn't in alignment, it's going to agitate the nervous system, which is your brain and your spinal cord. So the signals aren't being sent like they're supposed to be sent to the body.
Right.
Yeah.
See, now I think every little child should have
Oh, yeah.
physical therapy. Well, what about like the kids that like have part of the muscle weakness is part of their genetic disease state, like Down syndrome? Like they need a lot of PT, they need
Yeah.
a lot of feeding
Should be
therapy.
getting adjusted too. Usually a gentle adjustment would help, and checking the cranial bones to make sure that they're in
Mm.
alignment. Because during the breathing process, if the cranial bones are stuck, it's going to decrease their nervous system or their brain activity, because the cerebral spinal fluid's not going to be able to pump and flow to the rest of the body, which can cause rigidity and the muscles to
Oh,
tighten.
very interesting. So, like, it's not going to change, obviously, the genetic makeup of the child, but it could be very supportive.
It can help
Right.
tremendously. Yes, it can be like night and day changes in the child.
Yeah, and that's
They're
and,
adjusted.
and that's important too, because you can't just think of when you have a genetic disability that it's about curing or not curing. It's about quality of life.
No,
too.
Yes.
Ted, that is like an excellent example. And again, that goes back to, I think, one of the myths that we always at least walk alongside on the show is that for every problem, there's one solution. Of
Right.
course, in this country, it's
Right.
for every problem, there's one pill
Yeah.
and only one. And it's never one thing. That's such a myth.
In my practice, I really try hard to help people without drugs or surgery, all naturally, allow their body to heal from the inside out. If it's in alignment, our body should not be in illness and disease because there's less stress on the physical body. And as the child grows during the developmental years, it's so important that they're checked and adjusted throughout those years because of, if they're not, then they can have problems by the time they're 20, 30, 40 years old, that the only solution would be surgery.
That's a very similar philosophy to the naturopathic philosophy.
Yeah.
Of course.
Yeah.
Of
Yeah.
course.
It all works together.
Yeah.
That's why I do a lot of referrals to Dr. Shaw because,
And I refer to Dr. Ted.
yeah, we need that, that physical medicine part too. I can't do everything, so I'd love to refer to her because she does such a great job with her patients.
Yes, physical medicine. Yes. That is really important
Yeah.
to bring that in. So, okay, now I'm thinking about the kids again, because I love that we've gone from like pregnancy to infants. And I'm thinking about the kids today. And I see this a lot because my husband coaches girls lacrosse. Injuries. I'm seeing so many injuries and not really ever, like as a young girl, coming back from that. Like then we see she got hurt as a freshman and then later never quite right. Like how about a concussion?
Oh.
Let's talk about a concussion. There's protocol. There's concussion protocol. I'm just wondering your opinion on these.
Concussions are so hard. I'm not a concussion specialist,
Right.
but I do know that if there's a concussion, there's some neurological damage there in the brain because the damage to the brain. But getting adjusted, it will definitely help with the healing process and accelerate the healing process by removing any interference. Because if they are concussed, they're also probably going to have things out of alignment in their neck.
Right.
Okay, so then that's a really good
Yeah.
place to talk about this mythology or this misconception that a chiropractor is a back cracker.
Yeah.
Like I am a drug dealer as a
Yes,
pharmacist.
right.
You were, I don't know what you are, like a total whack job, I guess, right?
Exactly.
Yeah, and I'm a drug dealer and you're a backcracker. It's a
Yeah.
great example because I would hear that and thinking of traditional chiropractic, not like I've never heard anyone speak like you're speaking of it. And if I had a child that had a concussion, I would think, oh my goodness, they're gonna go in there and just be so violent
Oh,
and
no.
like adjust this kid and crack their neck and something worse could happen.
That is
So
scary.
Right.
Right. So
Yeah.
so you don't roll that way though.
No, I have an instrument that I use. It's called the Activator, and I use the Activator Method. So the whole neurological testing that I do on the patient is specific to each vertebrae to tell me what exactly I have to adjust. And the Activator works on speed rather than force. So it's just a quick, like little hammer thump on the vertebrae to get it to move enough to get in the more neutral position or normal position
Yeah.
so that the spine can move. So it is very, very specific. It's very gentle. I have different settings. So I have like number 1 to number 4. So it could be 18 pounds of pressure to 35 pounds of pressure for an adult.
Mm-hmm.
But for a child, it just, and I will always go through my thumb so I can feel the movement of the vertebrae and make sure it slides in. It's so amazing. And children love to get adjusted.
Mm-hmm.
They almost fight who gets to go first. And I treat families like moms, dads, children, and they are, oh, I went first last time. No, you go first. Usually like, who wants to go first? But you asked about the injuries. It will accelerate the healing process if a child is injured during like sporting events.
Yes, that's what I'm talking
Mhm.
about. Or a
Yes.
sprain or a strain or the knees. There's a
Yeah.
lot of knees with
Oh,
girls.
Yeah, and I
Because center
adjust
of gravity.
extremities too.
Yeah.
Yeah,
Okay.
I adjust knees, hips, feet, hands, elbows, shoulder, any joint in the body can be adjusted or could be out of alignment. So if it's out of alignment,
Wow.
then I can put it back in.
Okay, so even a joint.
Yeah.
Yeah, not just
Okay.
the spine.
That's
Yeah.
so cool.
Yeah.
Yeah. And I have to say that, growing up playing 9 years of football, that I lived at the chiropractors. And
Wow.
oh yeah, I mean, like weekly, at least
Yeah.
once a week, I had to be.
Your mom was so cool. She
Right.
knew.
He's right.
But I wish the chiropractor we saw when I grew up was amazing, but I really wish that I could have received the Activator method too, because
Right.
after a certain amount of time going so often and having the injuries, as soon as I got adjusted, it's back out of alignment because those tendons are too stretched.
I will
Great point.
say that sometimes, when manual adjustments are good because it does work,
Right.
but you can get some ligament laxity and stretching the muscles like a little bit too much. So then the body's not able to hold the adjustment.
So that's
With
why,
the-
because the process of adjusting it.
Yes.
Oh.
And so, you kind of stretch the ligaments to the
Right.
end range of motion, and then you stretch it a little more.
Right.
So it can cause a little bit of weakness so that your body's not able to hold the adjustment. So with the activator method, it happens so fast and the patient's in the neutral position. So I don't have to twist and torque them to get them in alignment. And so I don't stretch the muscles, but I do massage out the muscles. Like I will have a patient that's like rock hard, like their muscles are so tight and rigid because their body's fighting itself to hold it in alignment. And as soon as I go through my protocol with the activator method, then their muscles, their whole body relaxes.
Yeah.
I mean, it's amazing. It really is amazing. And then patients hold their adjustments longer too. So typically I'll see a patient like maybe once and then do one follow-up
How far apart?
within a week.
Okay.
And then depending on the severity of the injury, if it's something like severe, and if it's something that I think is beyond my scope of practice, obviously I'm going to refer them out of the office. Like I had a girl one time, she fell off her bicycle. And she was like about 8 years old. The parents brought her in 2 days later. I looked at her wrist because that's what she complained about. And I looked at the parents. I said, I can tell she broke her wrist. They're like, what? We thought she was exaggerating,
Oh
like,
my
I feel
gosh.
so bad.
Yeah.
And I was like, well, I'm not going to adjust that. But you do need to take her,
Emergency.
yeah,
room.
to the emergency room. And they sent her to Akron Children. And soon, like with that day, she had emergency surgery on her wrist. She shattered it.
And that's a great point
Yeah.
because people tend to think so much that, if I go to the chiropractor, then I could be avoiding necessary medical care too.
Yes.
But if you see a good chiropractor, they want the overall best for the patient,
Right.
and they're going to refer you to emergency room if needed.
Yeah.
That's an excellent point.
Yeah.
They're
Because
not
it's a good
fringe. Because you're
stopping-
not fringe. You're not outside the
Right.
system against the system.
Right.
You really should be much more integrated into the system, just
Yes.
like I think a naturopathic doctor should
Yeah.
Yeah.
be in we won't say traditional dominating system.
Yeah.
So then after, like, say somebody breaks a bone on the lacrosse field, God forbid, and then they get it set, can you still be adjusted with a
100%. They should. Well, not with the cast, but like
Right.
everything else probably needs adjusting.
Well, exactly.
Because if you have the trauma on the wrist, there's going to be trauma on the elbow and on the shoulder and into the neck.
Right.
There's like a chain of events that happens.
Yes, I was at
So-
CrossFit the other day, and one of the gentlemen that works out there, who has been alive as long as I have, and maybe a little bit longer, he was not doing something. And I said, well, why aren't you doing this? Like, this is your thing. 50-year-old jacked up guy. And he's like, because I tore a rotator cuff. So he's not getting it fixed. He's just going to carry on. And he goes, but if I really think about it, 3 years ago, I tore this one, had surgery on it. And I think because then I just shifted everything over.
He overcompensated.
Yes. And I'm like, wow, that's how it works, sir. Right?
Yeah.
It also, when you're talking about healing a broken bone too, anything in the lower extremity, if you have a cast or a boot or whatever, then afterwards or even during that, and especially after, you need adjustments because your leg length is totally different. You can't.
Yeah, you're walking around lopsided all the times. Yeah. The number one thing I try to correct too is men that carry wallets in their back pocket and sit on their wallet because it acts like a pelvic lift or a butt lift, and it messes up their low back, and they're wondering why they have low back pain all the time. Well, take the wallet out. I'll adjust you, but then take the wallet out so that you don't mess up your alignment.
Yeah, I was so glad I learned that early in medical school.
Mm-hmm. I mean,
so
it's
they
so
taught
simple.
you this stuff. That's amazing. It is such a simple thing.
Yeah.
Because as naturopathic doctors, we're also trained in physical manipulation too. So
I think I have forgotten that, Ted.
Some of our states where we're licensed, you'll have naturopathic doctors that are doing a lot of physical medicine and manipulation.
Really?
Yeah.
I had no idea. But you don't do it because of the licensure in Ohio. So you refer. That is so interesting. Okay. So now I'm thinking about, you're making me think about lifestyle. And so now if we move up past teenagers and injuries, about the people like in tech, the young people that are in tech, and they're always like this because they're at their computer and they do a lot of perhaps ergonomic design, like for their wrists and things.
Yes.
But what do you say about all that? Like, I feel like we're just molding our bodies in a different way, right?
Right. But everything is like folded.
Exactly.
With
our phones, like we're walking along the street.
I know. Everything's looking down.
It's awful.
Everything's down. So we should always have our ears above our shoulders, shoulders above our hips, hips above our knees, knees above our ankles is a proper posture. And like these pectoralis muscles in the front are so constricted and tight, rolling our shoulders forward. So it's important to stretch them, stretch them and like keep the head back. I'm guilty of it too, because all day long I'm looking at leg lengths and then I'm looking at people's back.
Right.
So my head's forward all the time.
We all have to be mindful of that. And of course you have all the kids are on their phones, so you have thumb injuries and
thumb injuries, and then they call it text neck.
Yes, that was what I was looking for. Okay. And so that's something that can be very helpful.
Yeah.
So in a way, like you have to be really aware of the time in which you live and how is the lifestyle and all these environmental influences impacting you from toxins in our food to like how we literally go about our day with interacting with our technology.
Yes.
And so in that respect, I feel like all of these things that they want to bring into the school system, maybe chiropractic would be something that we should be bringing into the school system while we fight and argue about everything else that has to be in there.
It would be so good for the children.
Oh, yeah.
My goodness, yes.
Yeah. But before we get off of talking about the texting and all that, something else that, all too often gets really ignored is carpal tunnel. And people think it's just in the wrist when normally it has a lot to do with your elbow and your shoulder.
And your shoulder. Exactly. Yeah. And I adjust elbows and shoulders too. I check everything on every patient, even their feet, their hands, their elbows, their shoulders, their neck. But yes, and the carpal tunnel can collapse, over time by using, a mouse and the keyboard all the time. But I do adjust wrists too. And I had a patient. This is crazy. Some people just want to have surgery, I think.
Right.
I think that they want something to talk about, honestly. So I had a patient and he's like, I'm getting carpal tunnel surgery in 2 weeks. I said, really? I said, can I see your wrist? And he said, yeah. So I adjusted it. I said, are you having symptoms now before I adjusted it? He said, yes. And I said, okay. So I adjusted it. He goes, wow, that feels a lot better. So I said, all right, I'll see you in a week. He came back the next week. I said, how's your hand? He goes, oh, it's fine. It doesn't hurt. I said, oh, are you still having your surgery? He goes, oh, yeah. But he was asymptomatic.
Right.
But the doctor said he needed it, so he's going to get it anyways.
Oh, I think that is such an excellent point.
Then I had a patient. I overtalked.
No,
I'm sorry.
No, go ahead. We'll go back to that. And then you had a patient.
No, I did have a patient that he came in, he had neck surgery scheduled for like 2 weeks, or it was about 2 to 3 weeks before or after he saw me. He said, I just want to see if there's anything I can do,
Mhm.
and maybe not get surgery, because
Right.
not everybody wants surgery. I know I don't ever.
No.
Um, and I know surgery is necessary in some cases.
Mhm.
If it's broken or there's no way around it, you have to have surgery. So he had neck surgery. I x-rayed him. I looked at him. I said, okay, this is what we're going to do. And I put him on a little treatment plan for like 2 weeks before his surgery. Then and I just gave him 2 weeks. I said, give me 2 weeks to work on you. And he was compliant, and then he disappeared. And he didn't come back. And I got so busy, I forgot to follow up, because that's what we do. And I thought about him from time to time, and I just figured, well, he must have had a surgery. 2 years later, he stops by the office just to talk to me, stops at the front desk and asks to talk to me. So they called me from the back, and I went up and I said, oh my gosh. I said, what happened to you? And he said, I just wanted to let you know, you helped me so much. I canceled my surgery. I never had it. It's been 2 years. I moved away, and I wanted to thank you so much personally. I was like,
Yeah.
oh my gosh, that's wonderful.
Wow.
I'm so glad you stopped.
But that's also with that other patient. They're in their head, oh, I'm going to have to get adjustments every week for the rest of my life to keep that
Maybe.
carpal tunnel away. I might as well just get to the root of the problem.
Maybe. Yeah, and I can understand that too. Like,
But
but
it also
could have
is
been gone forever.
right.
But yeah, or that's interesting. It could be that, or just like they don't want to go back and tell their doctor, I don't want the surgery, because the doctor will
They're
get mad
afraid.
at them.
Yes,
They,
that's
people
true.
people are
Yeah,
afraid of their doctors. Let me tell
they
you.
are.
They tell me some things as a pharmacist that they don't tell their doctor. And I'm like, I can
yes.
tell they're very afraid.
Mhm.
Like I've had patients continue to take medications that were having very serious adverse reactions to.
Oh,
I can't tell her I'm not taking it. I'm like, wow. And it's just like, well, that relationship must mean a lot to you.
Right.
So there's just something, and then they'll loosen up
Yes.
a little bit. Like
Yeah.
there's just
And there's
something
some
about it.
wonderful doctors out there. There are wonderful doctors.
Right.
Yeah.
The patient should be able to communicate with their doctor.
Right.
And
Well, they
share with
should,
them and feel comfortable with them.
Exactly.
And not
So
fear.
where is that healthy relationship, right? Like
Yes.
it is in my opinion, I, as a pharmacist, never like to do anything that would jeopardize that relationship. So even if
Yes,
it's
me
something
too.
like, right, and Ted the same way, even if it's like, well, what do you mean my doctor didn't call in my refill? I'm not going to be like, yeah, that office staff, they're such idiots. They didn't call in the refill.
Right.
It's always something like, oh my gosh, they're so busy. They care about you so much. Let me just give
Yes.
them another call. Like
Yeah.
little things like that.
Yes.
Because that relationship is so sacred. And I know
Right.
we all like believe that.
Yeah.
But I also have seen it where that has gone a bit off the rails, and the
Mhm.
patient really does need to value their relationship with themselves,
Yes.
at least enough to say, hey, what do you think about like my pain's disappeared? Or what do you think about, could we put this off? Or
Yes.
I don't know what it would take, but
Yeah.
that makes me sad, because that's not a good relationship.
Right. I know.
Yeah. So okay, now what about anything else about techie or like the tech problems that we're having,
I think that.
the tech
Yeah.
influences on our spinal cord?
Yeah.
Yeah, I so worry about that. Okay, then I also see, and this just came up last night where I was at an event with people that have been alive the same amount of years that I've been alive, and they have no energy, and I guess this is just the way it is. And when you
Oh.
reach a certain age, this is just, you just accept it. What would you like to say about that?
Oh my gosh, that bothers me so much.
Me too.
Yeah. So first of all, I try to encourage them to get adjusted, and see how they feel. But usually they come to me already. They're already coming in to me, and they're like, I'm tired. I'm not sleeping well. I have no drive, or, like no desire to do anything.
Okay, so that surprises me. Why would they come to you as opposed to like, well, I'll just, I don't know what
Well,
people do, drink more
okay.
coffee.
They're already your
Initi-
patients. They're
initially,
Oh,
yes.
thank you.
Adjustments.
Okay.
Yeah, they're existing patients,
Oh, okay.
that, or they might have
Or
a
they're very
pain,
enlightened. Okay.
or they might have a pain or something, like
Right.
my back hurts.
Okay.
And honestly, we can store emotions in our tissues.
I was just telling
So-
someone that the other day. Okay.
Yeah.
Mm-hmm.
People, like, they get upset, they get stressed,
Mhm.
and then they hold that stress in their body. So, like, and then their muscles tighten up, it can pull the vertebrae out of alignment. So once I adjust them and they relax, their overall stress goes away. But what do I tell patients? I obviously ask them, are you exercising?
Mm-hmm.
Are you eating healthy? Are you taking anything, any supplements, or what medication are you taking? And a lot of times, you were talking about the pharmaceuticals. Some of their, most of their problems could be side effects from the medication that they're
Right.
taking.
That can't be.
Oh, yeah. Most of it.
I always look there
Yeah,
first.
see,
I always look there first.
Right.
Even something as simple as drug nutrient depletion. We all
Right.
accept that now.
Yeah.
30 years ago we didn't. Now we
Right.
accept that.
Yeah. Yeah. So I once they start getting adjusted though, and I'll refer people to Dr. Ted if
Mhm.
they're like really struggling. And I'm like, okay, this isn't my field right here. Go talk to Dr. Ted. He is excellent and he knows his stuff and he will test you. And I don't understand how his testing works, but it works. And I kind of do because it's energy work.
Right.
And we're all energy. And
Yeah.
we have to
Right.
be in the right vibration for our body to heal, if that makes sense.
It does to me. Yeah.
So we all have a frequency.
Mm-hmm.
And the frequency, I'm going to mention this, of which might sound crazy, but that's okay. The frequency of love is 528 hertz. And if we're all in that frequency of love, I believe that we will not have illness or disease.
Oh, I'm so glad we're going there. I was
Yeah.
hoping we would go here. How about you?
I didn't even think about it.
Yeah. That's all I think about. My kids always tease me that I talk too much about energy. Yeah.
Oh, well, energy is
Frequencies,
everything.
vibes.
And
Yeah.
so our energy, even in our nervous system is energy. Our body is energy. At the cellular level, there's an energetic exchange. There's positive and negative. And at the cellular level, things have to be unblocked, or, the flow of energy has to be right
Yeah,
for our body to heal.
yeah, and I think that's interesting. So now I'm thinking back to last night and these two women that we're talking about. That's just how it is when you're 50 something. You're just, and
Mhm.
a part of me feels like that mindset is in of itself dis-ease.
It is.
Okay,
Oh,
thank you. Like it is like, wouldn't know what we would name that disease. And is there a drug for it? But there's just something about it that it does feel like a lack of self-love, maybe. Like,
Yeah, there's
is it?
something like they don't deserve it, or
Yeah, maybe some of that, but also, people being healthy takes a lot of work. And
Mhm.
by saying this is just the way it is, it gives them
I know.
permission
they're
to not
accepting.
work on their health, to not exercise, to not eat well, to not take care of
Mhm.
themselves because it's just easier that way.
Right. Yeah, and they accept it. They
Mhm.
accept being that miserable, whatever they're dealing with.
Right.
But there are 3 forms of stresses, and I tell most patients, I try to tell every patient, but sometimes I
Mhm.
might forget. But there's 3 types of stresses that can prevent our bodies from healing 100%. So there's a physical stress. So if we trip or fall down a flight of
Mhm.
steps, or we're in a car accident, or, get hit in the head with a football, or a concussion, that's a physical trauma.
Right.
We have a chemical stress, which is nutrition, our diet. If we're feeding ourselves junk, our
Mhm.
cells can't heal. So I say eat fresh fruits, fresh vegetables, lean meat,
Mhm.
and stay away from processed foods.
Yeah.
Then we have emotional stress. Emotions can cause physiological responses. And a lot of us, we're basically as long as we're alive, we are going to have all 3. Physical, chemical, and emotional stress in our
Mhm.
body sometime in our life, and probably all the time in our life.
Right.
Even if we sleep wrong or we have the wrong mattress, that could be a physical stress on our body.
Yeah.
Um,
Which
so-
then increases your risk for the emotional stress
yes.
and
Yeah,
the
lack of
chemical
sleep.
stress too.
A lack of
Oh my
sleep.
gosh, good point.
Yes. I mean, it's all a cycle.
Yeah.
So we have to pay attention to what we do every day. And I see some patients that are really, really sick, but rarely, but most of my patients are like healthy. They're vibrant. They live into their 80s, 90s, like high 90s.
and they're still like out riding their bicycles, because their joints are moving.
Right.
Once they get locked up, then we lose our quality of life.
Mm-hmm.
Oh, I think that's
Movement
so
is life.
interesting. Yes, because the ultimate lack of movement is death.
Mm-hmm.
Exactly.
So I think also when I hear you say their joints get locked up, I think our thinking gets locked up.
Yes. Our thinking gets locked
This is
up.
my limit.
Mm-hmm.
Okay, I hit this number. That's it. That's my limit. It's too hard. I'm not worth it. Whatever that is.
Uh-huh.
Right.
Or maybe one time, I have another patient story too, but maybe one time they might have hurt themselves like cleaning the shower. And they're like, oh my gosh, I can't bend over and clean the shower ever again because it hurt my back so bad. Like I can never do that again. Well, they can if they're in alignment. And,
Right.
but they have that fear of it coming back. So like living
Yes.
in fear rather than not fear.
Yes. So what? Okay. I think there's just so much to that living in fear. Would you say fear is the opposite of love?
It is. I was about to say that. Yes, it is. That's what I was about to say.
Yeah. So then
Mm-hmm.
I think so too. The unprecedented times, the pandemic created a lot of fear.
Oh, 100%.
So what have you seen? I don't know, personally, professionally. I'd like us all to answer that question because we're in the we're in the space of vibes now. Love v fear. What have you seen after that? What's been your professional or personal experience after that?
Yeah. I worked all through COVID.
So did I. So did you.
We all did, yeah.
Okay, we all did. This is perfect.
I didn't close my office.
Good for you.
I had patients that wouldn't come in because they were fearful.
Sure.
They were afraid to get on my table. And because they were like, oh, there might be germs there, even though I wash it, sanitize it every single time. And then I had patients that they were perfectly fine with it. I feel that it definitely divided people,
Right.
into fear or love.
Oh,
Interesting. Like, because some people were like living in fear, like, oh my gosh, I can't go outside. I'm going to get this virus and I'm so scared of it. And I think that if you fear something, it can hurt you. If you love something, if you are constantly in a state of love, nothing can hurt. It doesn't, there's no pain in love.
Interesting.
Yeah. But I saw a division
Mm-hmm.
in people big time.
It's interesting that's how you are seeing the division.
Yeah. And I
Seeing
still
that
loved
division.
what I did. And like patients know that I love what I do and they know that I love like helping them. I want to help people. That's my passion is to like help people in whatever way I can.
Yeah, yours too.
So,
And mine too. So what was your experience when it comes down to that? When it comes down to the COVID and so I wasn't going to use the C word there. I just did.
Oh,
The unprecedented times, like I like to call it, with people, just your patients. How do you think that impacted the well-being of Americans?
Well, I mean, that there, like you said, division of love versus fear, whatever it is, that fear part, I definitely saw that people that got the infection were a lot more likely to have a lot worse cases, that fear really affected their nervous system and their immune system to actually increase their risk for having bad infections.
Interesting.
I would agree with that 100%.
Yeah.
Yeah.
Your mindset, it has a lot to do with it. If you get sick, and I know you tend to be one that, if you get sick, you tend to jump more on that
I panic.
fear and panic.
Yeah.
But like for myself and, lots of people, if you're, you get sick and you're like, oh, I'm going to get through this and everything's going to be fine. That positive attitude can help you versus when you panic and then your body starts to think, oh, I can't do this, and everything gets worse.
Well, and the panic releases the cortisol, and then cortisol has an impact, and it does definitely have an impact. And for me, I saw my patients that were on one antidepressant were then on two. If they were on two, then they were on three. If they were on three, then they were on four. And I think there was one, there was literally 6. And I'm like, wow, that's something.
Oh,
And
that's
of course,
so
they're
sad.
picking up their prescriptions as they have 6 bottles of alcohol
Right.
as the checkout.
Well, we know that, alcohol consumption increased.
Yeah.
So I did notice that. I noticed more prescribing of antidepressant, anti-anxiety medication. And then to your point, great point, I noticed more and still notice a lot of self-medication
Yes.
Yeah.
with substances.
Right.
Various
noticed that too.
substances.
I did notice that too. But I also noticed that my patients wanted more all natural health care.
Mm-hmm.
So they were more compliant and they were sending more patients to me because of that.
Yeah.
That's an excellent point. Did you
Yeah.
see that?
Oh, definitely.
Yeah.
There was a huge shift. There's a couple of different pieces of that. Definitely there's a huge shift. People realize that if I'm healthier, I can be more resistant to infections,
Yes.
especially considering that early on, one of the big, we talked about all the big comorbidities that increase your risk for infections, which was, diabetes and heart disease and, obesity and things on that end that, it showed people I need to get better
Yes.
control of my health. But then
Mm.
on the other side of that too, people were getting some extra government money too, that then they can say, I can actually pay for this now, and I'm going to take advantage of that so that I can be healthier and get through.
Yeah.
See, this all is fascinating to me because I did have access to a lot of alternative health care. So I wasn't worried ever about a virus or my health. That's not where my fear lied. Lied? Is that a word? That's not where my fear was.
Yeah.
Okay. It was I was afraid of the government.
Oh, I get
Because
that.
there's not a naturopath, a homeopath, a chiropractor that is going to protect me from the government. And I was afraid of the government, and I will tell you why. Well, because of the shutdowns, and I didn't realize the federal government had that kind of power.
Right.
And I knew that was going to devastate a lot of people later, financially, economically, and there was going to be things. I could just feel that was going to happen. But when I would go into work, I'm just doing my job. And the State Board of Pharmacy would say, well, you can't dispense this medication today. One medication that
Oh,
in
I know which
particular.
one.
Okay.
Yes.
Right.
And I'm like, blah, 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 blah. Well, I could do that last week. Then I would come in 2 days later. You can dispense this medication.
Oh.
Then it would come in the next week. You can't dispense this medication.
Right.
So I felt like I've never in my whole career seen a chemical being politicized.
Wow.
Oh, yeah,
Okay.
definitely.
And that really scared me.
Yeah.
Because as
Yeah.
somebody who does really want to help people, I didn't want to be inhibited in that way. And then I just thought, well, what else can they do? If they can do that, what else can they do?
Well,
So that's what I was afraid of. I wasn't afraid of a virus.
no, but in my
Yeah.
practice, what I saw, is not specifically my practice, but naturopathic doctors across the country, there and in general, there was such a push to all we can do is try to separate and not infect somebody else and wait for vaccinations.
That was the naturopathic perspective.
No. But the overall government.
Oh, got you. Oh,
And
yes. Good
because
summary.
of that, we weren't allowed. You could not have any discussion about how to improve your immune system or do things to support your body. Not that they were going to prevent the disease, but help you to get through and get by and have less side effects of the infection.
Oh, excellent point. That of not being able to speak, I found also terrifying to the point where I could almost no longer speak. Thank God I had a good homeopath.
Yes.
But yeah, that really scared me. Like, since when is shutting down discussion part of the scientific method?
Right.
Who
Right.
did that? Our government did that.
Yes, it
like
did.
taking the scientific method and saying, forget it.
Yeah.
I didn't. That really scared me. That's a great point.
Yeah.
So what were the naturopaths doing in this? Were you guys sharing information about supporting immunity? Like, what were you doing as a people, as a community?
That really got shut down. And because everything was so politicized, I
Yes.
saw my community too go into 2 different camps.
You did?
Oh yeah. There was a lot of people, a lot of naturopaths that you wouldn't expect that went right to, hold the the line on everything that the government was saying because of that.
Fear.
And, there wasn't
Yeah.
there wasn't the big push that I expected for people to really try to help the public.
Excellent.
You know,
I'm
like
sure you expected that. Were you a bit disappointed in your people?
I was
Yeah.
because you look at,
If
for
not you guys, who?
we
Yeah.
don't talk about the homeopathy, but
We don't, but go ahead.
but the Spanish flu, that was a big thing with homeopathy where the homeopaths were seeing such higher rates of cure from the Spanish flu, and people were getting all better, and that was a big thing to help push homeopathy forward. But we didn't have those same types of things happen during the unprecedented
Good
time.
times. How about your community? What were they saying during that time?
Oh,
Chiropractors.
Okay, there was a division.
Wow.
Some were like, oh, you have to get the vaccine. Some I'm never getting the vaccine.
Yeah.
So I leaned on the side where I'm not getting the vaccine, although I've been that way for years. My children haven't been vaccinated. So that was another issue. I was like comfortable with that. I was
Okay.
like, I'm not going to get anything that's not proven yet.
So
Right.
so the division happened because
Within the
at the
chiropractic community, yes.
okay.
Like some were, anyways, yes, there was a division in the chiropractic community too.
Interesting.
But I know as long as you just like run your course and do the right thing, and as long as I knew I was doing what was right for me
Mhm.
and my family and my
Mhm.
patients, that was my main concern,
Right.
to keep them educated and not living in fear.
Yeah. And what happened, and I'm sure with your community too, as well as mine, is we were taking care of our own patients, but you didn't have big marketing campaigns or things like that, because that would get you shut down. I had colleagues that had been given cease and desist orders talking, with something on their website talking about vitamin C,
Oh my.
and
Here we
COVID
Yeah,
or
I did
things like
stay
that.
low. I was low.
Yeah.
But
And you had to.
Yeah.
You had to.
yeah.
Yeah. Stay off the radar. Which is kind of sad,
Yeah.
the censorship.
Right.
But I guess again, the technology is a double-edged sword, the social media and all of that stuff. Well, then moving forward, as we all must, right?
Right.
God willing, what role do you think chiropractic care could play in the system? Because it seems to me like it's still a bit, I wouldn't say, I think the fringeness of it,
Yeah.
and same with you, the fringeness of it is softened. Those edges have softened,
yes.
right?
Chiropractic has come a long way in the last 100 years, and especially, I think, grown tremendously in the last 5 years. So
How so? That's
Yeah.
interesting. Tell us.
just more and more people are willing to see a chiropractor, before they go to a medical doctor or before they have surgery. But I feel like it was like that before too, but it's even amplified now. Like people want to be well and they want to feel better and they want to have a better quality of life. And they, at least my patients are that way.
Of course, they would come to you otherwise.
Right.
The ones that I met last night aren't the seekers, the seek outers. Like they just
And then
accept.
what I love though is seeing a patient that has never been to a chiropractor before, and they're like, they were always fearful of it. They never thought they needed it, but they came to me just because they wanted to see if I found anything. Okay.
Really?
Yeah.
That has come a long way.
And and those are like some of my favorite patients because they don't like reveal too much, and then I'll find things wrong with them and I'll say, what happened here? And then they'll tell me. And then I'll say, okay, and this is out. And they're like, oh my God, I felt that, just the whole, and then just the whole curiosity of, okay, how can a chiropractor help me? But I have people that are very close to me that will never see a chiropractor. They won't even come see me, which you're going to have that.
Right.
That's interesting.
But I just love what I do, but a lot more I mean, it has grown quite a bit. Yeah.
And we'd like to, I think it should continue to grow, actually. And one of the things that you are doing that's kind of, it sounds like it's new to your practice. I want to make sure I get how you say it. I want to say it the same way you say it on your website. Here it says you're developing a cutting edge anti-aging program.
Yes. I've been working on that for a long time.
That's a hot topic. Anti-aging, right?
Yes. And I think that we all have, basically, I can't go into everything.
Yeah.
But I feel that as long as we alleviate all of our stress in our body and in our mind and at the cellular level, the aging process is definitely going to slow down.
Makes so much sense.
We have, do you know what telomeres are?
Yeah.
Okay. Telomeres are at the end of the DNA. And as we age, they start like disappearing. So there have been research studies that have shown and proven that through chiropractic adjustments, those telomeres do not disappear.
Interesting.
Yeah, it helps with the aging process just by getting adjusted. Yes.
You are so right about stress and aging. Because like some days I'll wake up and I'll like say, whose face is that? But I'll know like that the stress, I can see the stress on my face. I don't know if this has ever happened to you guys, but one time I was in this position of like abject terror. And I looked at my face and I didn't recognize it because I seemed like an animal.
Oh.
Yeah.
Oh, I believe that.
But because I'm like, and it just stayed with me like, wow, what's happening inside comes out in my face.
Yes.
I'm like, so I thought to myself, no matter how much like Botox or whatever we're doing, if inside, right?
It's true. It's going to come out. Yeah.
It's going to come out.
And you know what I heard? That's so funny that you said that. So probably 25 years ago, I saw this little saying and I thought it was so funny. It said, if your spine was on your face, would you take better care of it? You know, because people do everything to take care of their face and, you know, because that's what everybody sees.
I say the same thing about people's livers.
See?
Right.
Like, because we do a lot of derm in the compounding pharmacy, and that's the organ that you can see.
Oh,
So then we have to be very like compassionate to people. Like you think, well, they just have acne, like it could be cancer, like whatever. But no, like that's an organ you can see, and like, what if I could see your liver? Like you, I know, God, no,
you take care of it. Yeah.
But yeah, looking at my practice as being totally out of pocket, I've always found it amusing over the years how people say they can't afford it, but yet they can't avoid their $100, hairdresser every couple of weeks.
Yeah. And getting their nails done.
Right.
And lashes.
Right.
Yeah.
Well, but especially the hair. The hair,
especially.
That's the other stuff some people consider an extra. But the hair is a must, for all women.
Yes. And then even though we don't talk about it, I'm going to talk about it because you already did. When I first started studying homeopathy, I walked into the room of the class and everyone was the most youthful looking people I've ever seen in my life. Oh. And I'm like, because it's energy medicine, right? And I'm like, that's what I want.
Oh,
right.
Yes.
But it's like what you're saying. It was something that was coming from inside.
Yes.
Right.
It wasn't a room of plastic surgeons and their patients.
Right.
It was a room of homeopaths.
Yeah.
Yeah. There's something else on your website. Unless you want to say anything more about anti-aging, I feel like you do the same thing with, well, first of all, you both look so very youthful and vibrant and alive, but
right there too, Mary.
Oh, you're so sweet.
You
But that you like treating people with what they eat and what they put in their body and the supplements is just, it's creating, it's regenerating. That's what youthfulness is, like a regeneration.
Yes.
It's not something that we just have to accept, like, oh, well, this is how I have to be. And also being very sympathetic to people that have something that really doesn't allow them to do that. So I should always say that, right? Whatever that might be, we're very obviously sympathetic to that. We certainly don't want to, and I find myself doing this, like those ladies that had resources. Okay. And they've given up, like I have to be careful, like not to judge them. Like, who am I to judge their decision to give up on themselves? But I find myself doing that. And that is not really good because then I'm going to see that on my own face. Let's see. What else did you say that I thought was very interesting on your bio? And I wanted to ask you about that because we've already gone some places that I never thought we'd go, Ted. And yet here we are. Um, where is it? Why can't I see it now? You did not adjust your bio before.
No, I didn't. I haven't adjusted it in a long time.
This is it. I found the sentence.
Years.
Okay.
I hope it.
This is from your bio.
Okay.
Her approach to patient care has helped so many people achieve a pain-free lifestyle, personal success, and spiritual growth. I would like you to touch upon, because all of us, I think, can see a pain-free lifestyle by seeing a chiropractor such as yourself.
Yes.
I'm not sure that people would necessarily draw the line or connection between chiropractic and spiritual growth.
Oh, we're all spiritual beings.
Okay.
Okay, we're in this human body, but we're all spiritual beings.
Right.
So when I talk to the patient, I find out, like, first of all, what their pain is or why they're in my office. And then I usually will ask what they do for a living to find out their daily activities, because maybe their work could be contributing to it. And sometimes I'll ask, like, if they like their work. And if they're miserable in their work, I try to encourage them to do something that they love to do, because we need to fulfill our God-given purpose. We're created.
Amen, sister. Yeah.
We are created for Him, so that, because we're spiritual beings. I mean, that's how we are created. So if we're not in our right element, or we're doing a job just for money, or and miserable,
I am. That's me.
It is not worth it. I mean, it is not worth your.
madam.
It is not worth your health. Your health is more important than any dollar sign. And if you're in the groove where you are meant to be, or the industry, like, you're wonderful at what you do, Mary. I mean, this is, like, amazing what you've created with Dr. Ted and this environment. That this is your thing. So if you continue to do this, you will have huge financial success. The money will come later, but we're all so materialistic. Like, we have to have things right now. This person has that, so I need to have it too. And I've been there, and I've been so frustrated in my practice early on. Then I'm like, why am I struggling so hard? Because I love what I do. And the most successful people, they are successful because they don't give up too soon. You might get frustrated, and you might be like, oh, this isn't working out for me. I need to go do something that makes more money, or do something that I'm going to hate, but at least I'll have the money. But what is that when you're miserable, and you wake up and you don't even like yourself anymore?
So is it then that you've just, like, asked the question and opened that door for them to consider it?
Yeah, and let them think about it. Because I remember I've had patients that have, like, changed careers completely. Like, the one lady, she said, I didn't even know what I said.
Wait a minute. I go in because I want my spine adjusted, and now I'm changing career. I'm making an appointment.
This lady came in and she was miserable. And I'm like, and this was probably 15 years ago. I was still a younger chiropractor at the time. And I was like, what do you do? And she just hated her job, and she hated her life, and she hated everything. And she's in pain, and she's miserable. And I said, well, what do you like to do? And she said, I like to cook. I said, then be a chef. Go to culinary school and be a chef. And she thought that was the craziest thing I ever said, or she ever heard in her life. Like, nobody ever told her that she could do that. Do what you love to do, because if that's what you love, that's like your passion. That's your God gift. And she came in one day and she was beaming from ear to ear. I said, what happened? She said, I quit my job and I'm going to be a chef. And I joined, I found a school and and changed her life.
Yeah.
Like, it's life-changing.
I can't wait to make an appointment.
Yeah. Not that everybody's life changes, Right. But I mean, if I see somebody so miserable, I have to like dig deeper. Like, what is causing what?
Because you
why are you
understand the
stuck?
misery is manifesting in the body, and it's like a circle, right? Like
Yes.
there's misery on multiple levels,
Right.
right?
And
And that has
patients-
an energy, and misery has an energy, and it can land
Yeah.
in your spine, it can land in your
Mhm.
joints, it can land in your stomach,
Yeah.
Right.
Yeah.
right? Because like you just said, the
Exactly.
body stores it.
Mhm. Yeah. So not that I do that with every patient, but patients will tell me things that I'm like, why did you just tell me that?
Yes.
But I'm happy that they
Yeah.
can open up. And the one lady, she just like spewed all, I'm adjusting her. And then she got up and she goes, boy, I feel so much better now.
Yes.
Putting all that in.
Yes.
You know, so that's like
That's
a
magic.
spiritual like enlightenment.
Yeah.
You know, you
Right.
just
So that's a testament to testament to who you are as a person.
Right.
Not just a chiropractor, but a person, and also I would say a healer.
oh,
Dare I
you.
say?
Definitely. And
thank you. But I don't feel that I am, but I just
think so.
want to
Yeah.
help people.
but we haven't really talked about a lot of her office life and things. I mean, she's gone so overboard on trying to reach out and help people to opening different offices, like
Yeah.
going all the way to Sandusky,
Really?
with an office. And, you
I
went,
had multiple offices, like 8 offices.
What?
And I've grown the practices. And then a younger doctor comes by, and then I kind of like let them take over from where I left off. And then I'll open
Wow.
another office.
right.
But I've had 3 offices open at one time, 8 altogether.
Yeah.
And right now I have 2. I have 2 offices.
Where are your offices?
One's in New Middletown, Ohio, which is close to my home.
Mhm.
And the other one is in Huron, Ohio, which is near Lake Erie. It's on the lake.
Okay.
Yeah, so it's a 2-hour drive.
Wow.
And I'm there just Mondays, and I'm the only doctor there. And patients come in on Mondays to see me. I think last Monday, I had like 4 new patients plus my regular patient load. People refer people. They know it's Monday, so they come in on Mondays.
My gosh.
And it's beautiful, and they're wonderful patients. I mean, wonderful. Yeah.
Yeah, that is a great
like-
point.
yeah.
It's a testament to like your true willingness
And passion
to,
towards
to
helping people.
expand.
Yeah.
Yeah.
Right.
And then I've helped the other I helped them by getting them started, getting them launched, into
Mm.
practice, where they could have done it on their own, but I love helping people who are good people that just need a little extra,
Yeah, and they're probably very much like you, but haven't like bloomed yet, and they just
Yeah.
need someone to give them permission. Like they're probably someone who would want to say or do, and no other chiropractor, or they haven't seen it anywhere.
Yeah, nobody said yes.
You can do. Yeah, nobody
yes.
said
Right.
yes.
Yeah, like I have an intern no, she's not an intern. She graduated now, but she's a chiropractor in my New Middletown office. And she wanted to move back to this area as a student to do her internship. So she called all the chiropractors in the area. And I was the only one that called her back. Because she goes, can I do an internship?
Mhm.
Can I see your office first? And then she asked, and I said, sure, just send the paperwork.
Mm.
I never know where my life's going to go.
Right.
You say
You never
say
know.
yes a lot.
Yeah.
I do. It's hard to say no.
Yeah. But you're saying yes to like it's not like
I'm saying
being
yes to
pulled
good
in-
things.
Exactly.
Yeah,
You're,
I-
you're very aware of what's in alignment
Yes.
to you, and then you
Mhm.
say yes to the good stuff.
Yes.
Right.
Mm-hmm. Yeah, I do.
Mm-hmm. Yeah. Anything else? I love that. She says yes to the good stuff.
Right. Exactly. Yeah. I mean, her whole life and profession is about helping people and growing, and
Mm-hmm.
she's
Even helping other doctors.
well, exactly.
Yeah.
But that's the thing is you're
Uh-huh.
creating this big tree of practitioners that's branching out,
Uh-huh.
helping more and more people.
Yeah, yeah,
I
because there are
feel
more
that.
people. Because I will tell you, I had a patient. I love my patients, so I listen to them. But he said, Doc, you are so good. He said, I hope that you have so much success that you can't stand it. I was like, why would you say that? Like, I don't wanna- but it was endearing to me that he
Yes.
said that.
Yes.
But then that's where because I get so busy that I feel like, oh my gosh, I can't stand this. I need a break, and then
Right.
a new doctor comes along and I'm like, oh, here you go. This is for you. Here you go. This is for you.
and you
Right.
you
Yeah.
request
And
it, the
everybody
answer
lines,
comes,
yes,
and you say yes.
everything lines up.
Yeah, that's beautiful.
Yeah.
Well, this was a very enlightening conversation, and
Definitely.
we we went to all the fun places, I'd say,
we
Ted,
did.
and some surprising places. But I would like to ask you, Dr. Shaw, to just give us like one takeaway.
One takeaway would be to identify your stress or your stressors in your life and try to move away from that and move towards things that you love to do. And your overall health and well-being will be so much better. And find a good chiropractor.
Right. Of course. Yeah.
Of course.
Yes. Yeah, that was wonderful. Thank you so much, Dr.
Thank
Shaw,
you.
for being on our show. We really appreciate it.
Thank you.
Yes, thank you,
Uh,
Dr. Shaw. We have loved having
No.
you here.
Thank you. I loved being here.
Good.
So
Well, good.
appreciate it.
And thank you all for listening and supporting our channel at Take on Healthcare, and we'll see you next time.
Take on Healthcare was created and is hosted by Ted Suzelis and Mary Sheehan. The information contained in this podcast is provided for informational purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Mary Sheehan and Ted Suzelis, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations for warranties about guest qualifications or credibility.